We have a good friend here joining us, Tom Lee. Tom, how are you?
Good. How are you?
I'm doing great. I'm doing great. It's been a delight to work on FestiHealth. We just had I don't know if you had a chance to see the panel, but it was like just a wonderful panel. Great conversation about, all the way from how to manage things right now on dealing with something that is very practical to really implication of future opportunities that virtual health brings with it, together with there's a really wonderful community of people that are coming together to bring multiple aspects of the big picture from all over the world. I mean, but I like
it's
really
pretty fascinating. I popped in and out today, so it's definitely one of a kind so far. Definitely pioneering this space.
That's awesome. Thank you.
Yeah.
Thank you for being kind. Thank you for taking the time. I know that you're super busy. So for those of you who are joining us right now for our second keynote for the day, thank you very much for joining. We're overwhelmed by the registration numbers. I mean, we never expected to have, having publicized this for like literally a week and a half, and getting to thousands of people who are registered and coming to participate in something like that is really unprecedented and inspiring. And so I want to say a huge thank you to the team, to the FestiHealth team, for an incredible job in less than 4 weeks from an idea to this. I'm inspired to thank the community, people like Tom that really jumped in to help and really believed in that when it was just kind of a phone call that said, hey, I have an idea. Would you be interested to help? And Tom, that does many times.
No.
Sure.
Happy to chat. Yeah.
Yes. So great to have you here, and very inspired by Tom's work over the years. So I know Tom since he, basically, first of all, there's a Stanford connection, but beyond that, ePocrates, which was really the first real technology, IT technology that doctors adapted en masse and loved. I mean, I still remember the reactions of doctors. I mean, seriously, until this very day, I don't know if there's any technology that doctors will literally tell you that they love using.
Yeah.
Right? Love. Right? So that was when I built HealthTap, that was my kind of like goal, right? Like, how do we get the doctors, a network that became almost 100,000 doctors eventually, to love using the technology the way they like ePocrates? Because it was a synonym to something that I use all the time, and I really like using it, right? So that was, quite a while ago that I think about it.
Yeah.
Building ePocrates, yeah, right. To a very successful company that went public eventually as well. And after that, going and I still remember the early days of One Medical with an idea of revolutionizing this whole notion of primary care and access to care, and an idea that turned into an extremely successful company. Again, one public company that, when the rest of the market was going down, One Medical was going up. And that's a testament to how solid this great business that Tom founded just a few years ago became relatively rapidly, transforming primary care and access to care in general. And then now with the new startup called Galileo that I'm very excited to talk about today. So what an amazing journey, Tom. So why don't you, just like I did with David at the very beginning, we want to get to start by getting to know you as well, because I'm running a course at Stanford that's called Luminaries, Leadership and Change Making in Times of COVID, and we're hosting Luminaries. And one of the most exciting things is to hear the most inner, most granular thing that inspires you, that drives you, and want to know Tom as a person a little bit. So tell us a bit
We're
about
going
yourself.
deep into the soul, huh?
Yes.
Yeah, and we've got a pretty free-form structure, so I'm happy to cover whatever, but thank you for that context. It's fun. Great teams, obviously. Yeah, so I guess, what do you want to go to, this little kernel, or?
Yeah, what drives you? Why are you doing what you're doing? Why?
Yeah, look, I think I was lucky. I had this kernel crystallize for me. Everybody has different motivation factors. Some of it comes out of pain. Some of it comes out of just inspiration. I was a pretty good student, just going through the motions of whatever it meant to be a clinician. And, I love the practice of medicine. I always thought I'd just be an, academic generalist, but it was pretty clear when I got close to practicing medicine for real, like, as a profession, that I'm like, none of this makes any sense. And so I think just born out of frustration and irritation that nobody could explain why we did all these irrational things in the system of healthcare, and we're paying so much for it. And at that time, I decided, well, I got to figure out all the underwiring of healthcare, and so I just kept peeling the onion through business school, and I still am peeling the onion. It's a very big onion. It's been fascinating because it's such a big pain point. It's only gotten bigger over time, which means that the problem's, hard to solve, and there's more people attacking it. But and it's part of the catalyst why I wanted to work on Galileo, which is, there's still a broader problem. One Medical solves a great problem, but there's still many other problems within healthcare to attack sooner rather than later. So that's kind of been the inspiration. But, at the end of the day, you have to ask yourself why we have such an irrational healthcare system. Yeah.
Yes, absolutely. And we're talking about, the transformation. We call the Keynote fireside chat between bricks and clicks, redefining the future of healthcare. So give us the kind of the journey that you went through, with like thinking about, from one, maybe even back to ePocrates, but thinking about the patient journey and what needs to happen. And most important for me, I mean, you have a little bit more pattern recognition than most because there are several cycles that open and closed since you started.
Yeah.
So you can see things that worked, things that didn't work. Tell us a bit about the journey. Tell us a little bit about things that you learned in particular, and some lessons. I want to go after that to lessons that we can take to the future as well. But things that were solved or not solved, and how it impacts the way that we can get out of this situation right now to a better future. So,
yeah. I think the biggest backdrop, if you look at all the way from ePocrates to One Medical and now Galileo, there is a brick to click thesis in general through that, but it's really predicated on the landscape, right? When I was training as a doc and when we launched ePocrates, again, this dates how long ago it was, but it was wireless connections, really. It was a Palm Pilot era, and very little data could be exchanged. You wired it up and connected through a modem or cable internet if you were lucky, right? So that was the infrastructure that we had then, but that infrastructure forces a level of innovation needed, meaning we had to be very compressed with our data. We had to be very concise, but it forced us to design great mobile products that were really efficient. With One Medical, if you think about it, reimbursement plus technology was the ecosystem then, and it still is mostly the same, except the technology ecosystem is different. And we're now starting to see a change in the reimbursement ecosystem, but the vast majority of reimbursement was through office-based encounters, right? You couldn't bill for these kind of virtualized services and for very nominal amounts. So the vast majority of effort, that's why whenever you called a doctor's office for a simple issue, you had to see them in the office to get paid. And so it made no sense to me why we did that. And so with One Medical, we designed a model that allowed us to do this virtual care and remote care before it was even paid for and before primary care was vogue. This was pre-Affordable Care Act. But we also knew the tech stack was pretty basic. At that time, nobody was designing EMRs or workflow systems for offices. And so One Medical was born out of that era where you design a high-touch model that was process-driven, and then the tech was kind of supportive. And then if you look at today with Galileo, it's the inverse, right? The technology stack is so much more robust today. We designed our first stack at One Medical on Ruby on Rails, right? It was pretty basic. And I should show you some of our early registration forms and our early EHR. It was pretty basic. And today what we can build is completely different, right? And so given that inversion, frankly, the more sophisticated we are as an operator to know how the labor costs work, we can now design a digital-first model. But you couldn't have done a digital-first model when we started One Medical. It would have been untenable and frankly really hard. There's more receptivity to it today because of the economic environment and the tech stack, but you still need a ton of process, which is the unifying glue. Yeah.
Yep. So let's talk about it from a lens of what we've learned recently, COVID, right? So things got very condensed. Health was highlighted. The need for virtual. I mean, the actual absolute need for virtual channels became acute all of a sudden because we just didn't have a choice, right? At one point, still don't have a choice for many of us, right? So people were almost forced into virtual channels. So this period of time, right? Like I think that's like in the context of Galileo, but also just in general as an innovator, as an inventor, as a successful business person, as a doctor, right? How do you think about this context? And did it change something in how you think about things? Did it crystallize some of these notions that you thought about before? And what are the most important learning points that will bring us to a better place or than we were before, given where we are today?
It's interesting. I think it's having kind of two types of effects. For the folks that already kind of were there like us, in a digital first model, it's giving us more intensity on the core things that we want to continue to innovate on. So it's just like it's crystallizing the next things that we need to work on much more concretely. For the folks that haven't really been using digital health on either the patient or provider side, it's just a first step, right? But I don't think it's going to dramatically change habits. So I think it's opening some eyes and crystallizing others. So just like anything, it's a stress test. Sure. Some of it will sink in, and then the rest of it will probably relax to normal. Habits don't change that quickly, but we'll see.
And what about very interesting? So what was in your mind crystallized or highlighted during this time that maybe like a surprising moment or like something that's kind of a new insight or something that got strengthened or just maybe something that was an assumption that went away because you had a stress test for a certain period of time?
Not too much. I mean, our service hasn't had to change much, but if anything, it's made our job a little bit easier in terms of the cross-state stuff and, a few things like that. If anything, the payment architectures are changing, so that will maybe crystallize a little bit more in terms of how we innovate into this new payment architecture. So that's kind of, at least for us, there might be others that maybe looked for a feature or otherwise, but we're pretty happy with the architecture that we've got today. And we know that, it's still a very early V1 service right now, but the roadmap hasn't changed. Yeah.
Talk about the connectivity, right? So healthcare is very siloed, something that all of us experienced, pretty seriously in everything, the thing that we tried to do in healthcare. In the previous panel addressed it a little bit and touched upon some of the challenges that this whole notion of fragmentation is creating in healthcare, because traditionally each and every one of the pieces of the healthcare experience is just operating separately, where it's information on the one hand, access to doctors on the other hand, medications, each and every one of these kind of operates in different places. And I'm just curious if there's something that has to do with the movement to virtual channels that can create like a centerpiece that things will kind of consolidate around and crystallize around in a better way that will start tying more of these together. So I'm curious to hear what you think about interoperability, about connectivity, about network effects, and is virtual care the opportunity to do that?
Yes and no. I think the analog right now is, if you think about when you're in a Zoom party, it's not the same, right? It's a one-to-one conversation. It's like 10 people at a dinner table, but only 2 people can talk. So there is kind of less connectivity and, less jazz happening. And it's just, one conversation, another conversation. So the weird form factor that we're in actually is, I don't think, as conducive towards when you're in practice together or in a more fluid dynamic, how that works. So we're not really mirroring the fluidity of human physical contact in a digital ecosystem. And so you end up with these very single wired channels, which are really awkward, right? As you've probably been at one of these wine parties. So it's it actually isn't conducive in the way that we're using it right now. If you think about
Yes, that's the
Slack,
question. Is just because the tools are not quite there yet, or because it's just impossible?
yeah, well, it's form factor, organizations, and it's the architecture of that fluidity, right? So I think people don't think about it too much, and I think Slack's a better example of where that works a little bit more. But then the question is, how do you merge that? So, you know, maybe the house parties of the world will find their way into this profession, but until then, I think it's still to be forged. And what we do naturally in the physical world, which is audibilize to context and adapt very dynamically, the tech is still pretty static, and so you kind of have to use it in very deliberate moments, right? And I think we're just not that deliberate in healthcare, so I think it'll be a while before we make the technology as deliberate as what we do naturally in person.
Yeah, and I think it's worth going up this learning curve. I mean, this is what we're doing with FestiHealth basically, and I'm looking just at statistics now as we talk, where there are hundreds and hundreds of people in each and every one of the interactions doing different things. Some of them are real-time interactions, like you're saying, this the synchronous, asynchronous. So we can have a conversation here, right? And there are hundreds of people watching the conversation as we speak, right? Mm-hmm. But at the same time, there are people doing activities, right? Like they're doing yoga sessions and they're doing exercise session, they're watching the booths, right? They're having conversations. I'm looking, there are meaningful conversations that are happening in that context without interrupting us. A little bit like in a park, so there'll be more, and you can go in and out, right? You're not stuck. I don't think the technology is there, just like you're saying, it's far from being there. This is like point one, version 0.1. But the question is, how can we think about this thing in healthcare? Maybe, and I suggest something, because one thing that I'm looking at a lot is like the gamers communities. Yeah. Because I think that in one funny way, they're innovative. They're a lot more innovative than we are in healthcare. But if you look at some of their interaction there around some of the gamer communities, it's very rich. Rich.
Yeah, I don't disagree. I just think that when you think about it in a professional construct, there's just there's a goal to be done within a healthcare process, and those are all over the map. So how you use that, it's one thing to kind of have a few simple concepts like, hey, let's watch people do something and have a conversation about it, versus, how are we gonna make a decision on these types of issues? Yeah. But it's an enabler. There's no question, and ultimately, we're looking forward to seeing how this shakes out. Yeah, you never know. I mean, we're seeing a lot of intensity on the economy and the systems and individuals, and that creates a lot of innovation. So separate from whatever ecosystem is there 12 months from now, I think we'll see some really interesting outcomes.
Yep. What are you excited most about in innovation in virtual health? Like what are the areas, whether you are working on them yourself or observing or investing, or what are the things that you're most excited about when it comes to innovation around virtual health?
Generally speaking, I think that this kind of life science and data equation is really interesting. So where you can get more interesting, subtle biomarkers, it's giving clinicians new tools to diagnose and treat. So I think that's going to be interesting, and the virtualized environment is perfect for that. Reimbursement is still always the question, but there's more value-based providers that are agnostic to it. Obviously we're structured that way, so increasingly the economics and the technology are starting to line up, where you truly can get transcendent care experiences that you can't even replicate in a physical environment. So, I think that's going to be exciting. And the nice thing about that is, that's a matter of quarters and years, not decades, right? Yeah.
Yeah, that's super exciting. And you're watching the the quarter by quarter management of companies right now with a public company that you started. I know that you're not with One Medical anymore. You're focused on Galileo right now. And there's like a dichotomy here between, managing things that are large and more sustainable and working in a certain way versus in managing innovation. So one of the things that we're doing with FestiHealth, we're going to actually announce here startup competition around virtual health. We're collaborating with StartX, which is the accelerator that spun out of Stanford University. We're collaborating with American Heart Association, with the Nina Vasan Center for Health Innovation at Stanford to really bring entrepreneurs to create more innovation in healthcare. But as an entrepreneur, as a successful entrepreneur, several times successful entrepreneur, what is some advice that you give to entrepreneurs, particularly in the health space, to really become successful in what they're doing?
Yep. I've got a few tidbits. I mean, these are cobbled together through a variety of conversations I've had, but probably one is be clear about what you're trying to accomplish. That's true of any startup, but in healthcare, people often lead with mission and heart, which is great. That's why people are really focused on it. But often the economics and the mission don't necessarily align. So you kind of have to figure out how to hybridize the two if you really care about mission. And unfortunately, the economics of healthcare don't always match the mission if you're trying to build out a successful financial company. So I think that's usually number one. The related corollary is follow the dollars, right? So you got to understand the flow of money in healthcare, which is counterintuitive. Yeah. And probably the third is try to design for both worlds, current and future. I just think that people anticipate this future economic world, and it's just, it's slow going. So you kind of have to work, with One Medical, we designed a model that works in a fee-for-service and a value-based way, even though it was way before value. And the same is true of Galileo. So if you can operate in both today and future, then you have an economic model. If you're waiting for the future, that's a bit challenging. If you're dependent on today, that's very limiting. So I recommend that in general, those are where people get tripped up. The rest of it's just, typical execution.
Typical execution. So what when you're thinking about Galileo, just in general, right? So tell us a little bit more about it, so we all understand where you are right now, and in the context of what you're doing there, how do you see things evolving for the current project that you're on?
Yeah, I mean, obviously, I'm a very big supporter and fan of One Medical, and the team's been doing a fantastic job through this crisis. One Medical was designed to reinvent primary care, and it's going to continue to do so. It's got a footprint that's mostly urban and commercial, and for me, I wanted to solve the broader question, which is how do you bring high quality care to everybody else? And so it's really more of a digital first model. We've re-examined how we make clinical decisions in general and how we make that more available to everybody on both a mobile first platform, but also in a high intensity care environment. So we're looking at quality and cost. The cost equation is frankly against the most expensive 20%, right? That costs 80% of the dollar. And there, it's a combination of human touch and technology, right? So, so that's kind of how we're looking at it. It's a bit of a beast in terms of what we're trying to tackle, but yeah, you got to leverage your experiences. So, otherwise, it wouldn't be challenging.
Totally. So value. So you are going into value-based care, as you're basically making a bet on value-based care as something that is here to stay, and it's going to become. We talked a little bit about that. Thinking about the reimbursement and where things are now and where they're going. Personally, big believer in value-based care. But curious, is this something that you believe will be very important going forward?
Well, I mean, we believed it from pre-One Medical days. It's do more for less. If you're looking at one problem in the healthcare system, it's do less for more. So a great business model in healthcare is do more for less, right? And if you call that value, that's great. But I think that's our general bias. So and it doesn't necessarily mean value-based contracts. That's one way to be rewarded for a value-based organization. But in general, if you can do more for less, that's what the healthcare system needs. And so, with One Medical and Galileo, we're constantly looking at how you can deliver better outputs of healthcare, which is generally quality, service, and access at lower input and lower total cost of care. There's just not a lot of energy focused on that side of the house, because it's just not as sexy or fun or obvious. But that's where the innovation comes from.
Yeah, absolutely. So thank you for that. And we started with Tom the person, and I want to end with Tom the person. We're in the middle with Tom the successful business person, entrepreneur, and the transformer of healthcare in many ways. And now I want to talk about just Tom's aspirations for the future, right? So Galileo is successful now. We're doing really well with the third one as well. And we're thinking about a little bit more into the future from a personal perspective. What are some aspirations after so much success, after so much accomplishment? What's next?
Oh, I mean, look, I think those are just kind of outputs of a life of curiosity and maybe some intensity. But I like working on problems that impact society. So healthcare is obviously a big one. But yeah, I think. I've got some side interests in how do you improve the political system? How do you make it less divisive? How do you engage people better with politics? Because it is a lot of root cause. If you look at a lot of the root cause of broader societal issues, it's the lack of ability to organize effective, government or impact, role of government in society. So to me, that's a really interesting problem when you get to more root cause items, and then also the environment. It's hard not to ignore that. So I've got some other work there. But I think, the good thing, it's obviously a tough crisis for a lot of folks here, but I think it is forcing, I think many people have said this already, but it is having us rethink what we're doing to planet Earth, and maybe we can reboot how we think about society. It's the whole, how do you balance capitalism a bit? So I think mission-oriented entrepreneurship is a good way to balance the forces of the mighty dollar.
Fantastic. Thank you for that. Definitely the current crisis highlighted the real need for real leadership and real great government, and how important it became all of a sudden in the lives of all of us, right?
Yeah.
So kind of something peripheral to all of a sudden becoming central, and rethinking it, right? Because a lot of things change, but we didn't think about that for a while. So thank you for thinking about that, because I think we will need a lot of help there. So
yeah,
and a lot of great people to do it, but it was a true delight, Tom. Yeah. I really appreciate your time. Thank you for helping to transform healthcare.